excited how President Trump has been working with private enterprise to solve these healthcare problems. You know, we've talked many times about how government's been the problem. We got to get them out of the way so that we can get medical care directly to the American people, and not even just in times of crisis, but certainly this crisis has solved a lot of problems, as President Trump has said. One of the problems is, okay, so you've got all the Americans told that they've got to stay at home, right? They're under lockdown. You've got Americans being told that even if they've got symptoms, don't that they think are COVID, to not go to the hospitals. So what are they supposed to do, right? How are they supposed to get any medical care? Well, enter private enterprise, who always has the best solutions in the most efficient manner. Joining me now to discuss this is Adam Hardage. He's CEO of Remote Health Solutions, a service-disabled veteran-owned small business that provides leading telemedicine devices and remote medical services around the planet. And he has been working with the White House and the Trump administration and the task force and helping the people at home get medical care. And he joins me now. Hi, Adam. Welcome to the Andrea Kaye Show.
Andrea, thank you so much for having me. It's a real pleasure to be here, and I've got to tell you, I love the support for the administration, and all of us at Remote Health Solutions are big supporters of President Trump and his administration. We're trying to make sure that he gets all the support that he needs, and frankly, you said it best yourself about 2 minutes ago when you said he needs more of it, and we could not agree with you more.
So let's, we all heard about, I think it was a press conference last week. It was about telehealth services, but it was more specifically to seniors that and through Medicare that they were going to set it up to where seniors. But is this now working with you more than just help to seniors? Tell us how it's going to work if anybody is at home or sick and needs medical help. How is this going to work?
Right. So complicated question. Let me try and break it down pretty simply. For our company specifically focuses in two areas: the Defense Department, so we support our military medics overseas and even at home, but predominantly overseas, so in a global environment and austere conditions. And then the other major thrust of our business is the elderly, chronically ill Medicare patient population. So mom or dad has COPD or chronic heart disease, some kind of a major issue that needs a monitoring plan. That's what we do. So what President Trump recently did when he announced the reforms to Medicare was to lower some of the state-by-state burdens that are there, and as well allow physicians to treat virtually across state lines, which is fantastic, because
Wow.
what that means is now a doctor in Wyoming can treat a patient in Virginia. Because let's all be honest. I mean, doctors are trained to the same degree to a certain extent. As far as if you're a U.S. board certified physician, you're going to be a good physician, whether or not you have the nuances of a state specific law. For most of the issues that patients are dealing with, the state specificity doesn't really apply. At Remote Health Solutions, we're very fortunate because our chief medical officer has 12 different state licensures. And now after President Trump lowered the requirements to allow physicians to treat across lines, now he can see patients in all 50 states. So we currently provide those services right now to chronically ill Medicare patients. And we have also, I think we are the first company to have ever remotely monitored and treated a COVID patient. I can't say that for a fact, but I think that's the case.
Okay.
And so our chief medical officer, Dr. John Baugh, and he is worth a Google. He's a pretty impressive guy. He and our VP of Clinical Services, nurse practitioner Stacy Welker, they both are on duty and on the front lines every single day. They do about 15 shifts in either the ER or the trauma department, seeing patients, and they've currently got multiple patients on ventilators, and we're seeing that this is becoming it's a major problem. It's a real problem.
Which aspect is a problem? Because I see it all as a problem. I see those that are on ventilators and in hospitals and needing care. That's a problem. What's going on, as well as seniors being told and others being told, because we also have seniors as well as others that are compromised, immune compromised, and COVID
Yeah.
can even get. We've got a problem to where our hospitals need support, and we've got some issues there, but we also have people at home that need care from home, because the whole thing about flattening the curve and everything that's going on with the shutdowns was meant to
Yeah.
try to keep the hospitals from being overrun. So we need an ability for people to get health care from home. And that's why I was so
Yeah,
excited to hear about
absolutely.
this. And to think that you're doing it across state lines is extraordinary. And I'm hoping that means that going forward, when this is all over, that this might be a new, aspect of our healthcare system going forward, including our health insurance. So,
It absolutely is going to be that way. And I'll tell you, too. So right now, we have a remote patient monitoring chronic care management program that we do for the Medicare patient population, as I mentioned. We have nurses, nurse practitioners, doctors on our staff. So we provide the service. We also provide the hardware. We provide the software. We provide a cloud platform that allows all of that data to move. And so when we send a device to a patient's home, they can check the vital signs. They can record diagnostic images. They can have a telemedicine, meaning a video visit with a doctor. They can do all of these great things. And then we also have that on steroids, which is where we can do like an EKG, live stethoscope reading, video intubation,
wow.
like all kinds of crazy stuff. Yeah, it's really an impressive technology, and it's there. And so if we want to flatten the curve, the name of the game is isolation containment. And so this is where you and I really see eye to eye as far as President Trump needing more support. So we have been, my company and myself personally, as the CEO of this company, I've been on the Hill since the middle of January. I've met with Vice President Pence's advisor for Health and Human Services. I've met with HHS themselves, CDC, many members of Congress, many members of the Senate. We have the support of the Virginia delegation. We have the endorsement of Army Futures Command, the endorsement of the Pentagon's Joint Surgeon, some Air Force units, some other things. The bottom line is our company has been all over this thing for the last couple of months. And I will say President Trump and his administration are exhibiting tremendous leadership, but where it falls short is there's a gap between when the boss says go and the rest of the tail, so to speak, then following.
Now,
So
who's in that gap? Excuse me for interrupting. Who's in that gap? Is it Fauci? Is it Birx?
No. I'm not throwing.
No, I'm just like, I'm just
them under the bus.
I'm
What
not,
I'm saying is,
and I'm not suggesting that either. I'm trying to identify the gap, which my guess is not a personal thing, but it's about the fact that our government, it's like Fauci said to Congress, our system just isn't set up,
correct.
right
So
now.
here's where it comes. Here's where the rubber meets the road, so to speak. Is that the president says, "I want X, Y, and Z to happen," and then he turns to his supporting agencies, whoever it is in that case. It could be the Defense Department or HHS or CDC or you name it. I mean, the government is a big bureaucracy,
Right.
and he says, "Make that happen." And then the head of that agency turns to their people and says, "Make that happen." And then those people turn to the program managers and say, "Make it happen." The program managers turn to the contracting officers. Contracting officers say, "Well, it goes on and on and on."
Yeah.
And then inevitably just gets bogged down. It's like trying to ride a bike with a greasy chain through beach sand. After a while, it's just not going to happen.
I get it because, my mother worked for the federal government for 40 years at pretty much every agency from interior to labor to justice,
Yeah.
and, and I'm familiar with all the layers of bureaucracy and, in terms of CDC and National Institutes of Health, it's, and the FDA, it's under the guise of protecting people, all these restrictions and regulations have left us with China, producing 90% of our medicines, and it takes
At
a
Food
long
Lion,
time to get
this is our
stuff to the patient from the marketplace. And Trump has
Don't
tightened
even
it up
start
like crazy.
on the antibiotics and the and the antivirals overseas. That's a whole other thing we're going to tackle next year.
And continue to make people aware of your company and what you're all about. Adam Hardage, thank you so much for being here. I appreciate it.
Thanks, Andrea. And by the way, if anybody wants to support us, they can reach out to us at rhsusa.com, remotehealthsolutionsusa.com.
All right. Thank you, Adam.
Thanks very much. Appreciate your time.
All right. Now, y'all stay tuned. We got our buddy.